Today we're joined by two speakers from the UBC Library Research Commons, Eugene Barsky and Jeremy Buhler. Most of you met Eugene at the last workshop, but for those of you who are new, Eugene is a research data management librarian responsible for curating and managing research data here at UBC, as well as being involved in various federal and international data repository services. Our second speaker will be Jeremy Buhler, who is a data librarian responsible for UBC Library's collection of open and licensed data. He also works alongside specialists in GIS, digital scholarship, and research data management to provide access to data for teaching and research, and to help researchers develop skills in data analysis, manipulation, and visualization. So thank you both for sharing your expertise with us today, and I will let Eugene take it from here.
Thanks for inviting us and for keeping your video on. It's so nice to see humans and not just myself. Is so tiring to see yourself on the screen all the time, especially if you have Zoom meetings all day long. And thanks, Jeremy. So for the beginning of the session today, my purpose is to talk about the data repositories and data sharing. But before I start sharing the screen and going through the steps, as I learned last week, with the participation was kind of on the low end. I was hoping to have a conversation first and explain myself a bit more why we are doing what we are doing and show you some examples. So today I want to talk about I would like to start with discussing storage, data storage as a continuum, because I feel that we not always on the same page with researchers or with the IT. When you talk to various professionals on this campus, to ethics, to advanced research computing, to UBC IT, to Med IT, we all speak a bit different language. So I want to make sure we're on the same page. So when we see data storage, we see a continuum of data, or variety of data storages. We see the work you do on a daily basis with data as you collect your data, your surveys, your RedCap presence, your data in OneDrive, whatever you do on a daily basis as active data storage. That storage is usually managed, depends. It can be by departmental IT, it can be by central IT. It depends on the size of your data. If your data is really large, you might be using Chinook or advanced research compute storage or compute calendar storage. If your data is normal size, under terabytes, you would use a OneDrive, which has a privacy impact assessment done for the institution, and it's legit to use. That's not what I'm going to talk about today. That's the active data storage. That's the stuff you do on a daily basis. And the next stage of data storage is a repository data storage. Is when you're ready to share your data with the world. Is when you're ready to open your data and make it findable and reusable and interoperable under FAIR principles. That's the topic of what I'm going to discuss today, the second stage of data storage, which is a repository storage. Of course, after that, there's another stage, which is archival data storage, dark storage, where we keep the stuff for 50, 60, 100 years to come. If somebody wants to find data that is published in our repository, we're actually going to take this data and preserve it for the next generation or two in our dark data storage, where people cannot access it on the web, but they can access it when needed. So if data is broken, if the checksums show problems, if it has a virus, we have an access to this dark data storage. And again, this is not the topic of my discussion today. Today, I'm going to talk only about repository storage and the variety of options for you to use. And I'm going to take only 15 minutes to do so. And then Jeremy will come in and discuss a completely different topic of finding data. So I just wanted to be on the same page with you. And if you're expecting something else, feel free to log off. Or I promise you it will be interesting, because we are going to discuss metadata. We are going to see how different repositories interact with each other and why would you deposit in a repository overall. And before we jump in again, one more question. Did anybody hear ever about something called FAIR principles? Maybe a show of hands. Anybody heard about FAIR principles for research data? Thanks, Nicole. Thanks. 2 people, that's good enough. I recommend you to Google it because you will see a variety of resources on the web. I recommend you to take a look on the page for Stats Calendar, for instance. Statistics calendar when they explain what FAIR data means to them. I will summarize it for you in the one sentence. So FAIR is an abbreviation. It stands for findable data, F, A first, accessible data, which is A, interoperable data, which is I, and reusable data, R. And when we talk about those principles, thanks, Jerry. When we talk about those principles, depositing data in a repository, be it a subject repository or general repository, which we run in EBC, will ensure that your data is compliant with the FAIR principles. We will make your data findable. We will make your data accessible, interoperable, and reusable, and I will be showing how. Again, that's the purpose of my quick presentation today. I'm going to share my screen now, and everything we do in our work is kind of walking the talk in open scholarship, and all the teaching, all the guidance that we do is open access, and you can see it. I'm putting the link in the chat. The workshop for today is here. And the discussion today is about depositing in the data repository. I want to show you how it works first before we actually talking about the repository. The idea of repository is a place where we open the research data to the world. It doesn't have to be fully open. The data files can be locked, can be quasi-locked. Only metadata can be open, depending what kind of data it is, if it's sensitive data, indigenous data, and so on. But the idea is it's a place where the world can see your stuff. And they don't have to come to us to see your stuff. They will see your stuff wherever they are. So I'm going to show you an example. I'm going to our collection, which is a UBC Dataverse collection on a national repository called Borealis. Lots of names here. So Borealis is a shared repository between 75 institutions, more or less, all Ontario, all Quebec, most institutions in the West. We share it all as a national bilingual data repository. And we have a space on that repository called the UBC Dataverse collection, where I have around 20,000 data files. We are the largest in Canada. I'm going to show how FAIR principles, I'm going to look for my own data sets. And I'm going to show you how FAIR principles work in practice. Quick search. Really odd. It didn't, I guess it didn't react for me for a second. Let's do it again. So I find 7 data sets for my own. I'm going to sort it by newest. And I'm going to, the first one is my youngest daughter, actually, but I'm going to take the second one and see how what happens if you deposit data in a repository. I took some keywords from this data set. The data set is, this specific one is open to the world, which means if somebody searches Google Scholar for similar keywords I just typed in, I just took from the title. I didn't take even entire string. I took some. If somebody's searching for anything in Google Scholar with those strings, they will actually find my data set. That's nice. I'm going to search somewhere else. I'm going to take us to Google Dataset Search, which is another place to search for data, and my data is there too. I didn't do anything to put it, well, actually, it's not a good example because I did a lot to put it there, but it's all behind the scenes. If I took your data set, you wouldn't do anything to get it there. I'm going to show another example. This is let's go to University of Toronto. This is UBC data on UBC repository. But if I go to University of Toronto Library and do a search in the library, in the completely different institutions for similar keywords, hopefully it works. I was experimenting earlier today. You can find this data set there. It's all available. If I even go to a European Union, OpenAIRE, if somebody comes from a European Union, you will know OpenAIRE. It's the biggest repository for scholarly objects in Europe. And if somebody does search for those keywords, they will find, fingers crossed, our data set there. Why? Why is that? Because our job in the libraries, here's the data. Our job in the library is to make your data as interoperable as possible. What we do, we take your data, we address it in a metadata standard. We take your data in a sense that we make sure the data is well described. Then we crosswalk it to a variety of metadata standards that different repositories can read. We crosswalk it to DataCite, which ships this data to Google Scholar, for instance, or Google Data. We put it in schema.org. We put it in Dublin Core, and we ship this data to a variety of providers across the web. So people, wherever they are searching for the data in their own discipline, including National Library of Medicine, this data should be in LM data search. It's completely new. They just created this repository. Is it this one? Not positive. Let me just take a look. I'm not positive about the URL. Data.
Is it MESH? MESH?
No, MESH is the subject headings. MESH is the subject headings only, but they now have a data catalog. I just can't remember what the URL is. Let's experiment together. LM data catalog. We'll talk about MESH if you want, because yeah, that looks like this is it. I'm going to do a search, and fingers crossed we'll find it there. And the reason is we actually shipping data to a variety of providers. Here it is, which is nice. Really, we really make your stuff findable everywhere. By putting the data in an appropriate platform and crosswalking it to different platforms, we assign DOIs which make this data stable on the web. If somebody clicks on it, you will always land in the same place. The URL will resolve to persistent URL, which is a DOI, and will always land in the source repository for the data. You will always see the data set as it was, and it's all relatively new. 2023, and it's well used, well downloaded. What I'm trying to say here, and I'll invite you to ask questions. I haven't started yet. I just want to show you how data functions in the world. What I want you to say is by depositing data in established repository, the repository managers, the data curators like me, will ensure that your data, one, is findable on the web, has a DOI, is stable, then two, is interoperable, different systems can read it, and three, it's preservable. We put the proper license, of course, to the data set that you decide what to use, how to share it with the world. And we put it in a dark storage to ensure the data is going to be around for a long time. It's a big thing, and it doesn't cost you, nothing, because we cover the costs of scholarship, we cover the cost of storage, we cover the costs of managing this data, and so on. We really walk the talk to making data as open as possible for as long as possible. Now, any questions so far? I don't want to see the chat.
Eugene, excuse me, Sina. My first name is Walter.
Yes.
So I was so we have, let's say we have clinical data, right? Health sensitive data.
For sure.
And so how we can anonymize and so on, of course, but once we publish they're anonymized, then anyone can have access, because Nicole and I, we've been doing the Dash course, and we can access, but just to a superficial level, just the metadata initially. Then we can ask for access and so on. So once you publish there, yeah.
Let me answer that and see if it satisfies your your need. So here's an example. It's I don't know if you guys are affiliated with that team. It's in the Children's Hospital, if I'm not mistaken, Pediatric Sepsis Lab. We have around 50 data sets from them. All those data sets, maybe except 4 or 5, are sensitive data. Yes, they are anonymized. The micro level data is removed, so we won't be. Users will not see the, for instance, if it's a survey, they will not see IP addresses of the people who answered that survey, for instance. We will make sure for that. But the data itself is open to the world in an interesting way. The data itself, we open the metadata for the world to see. So all the backgrounds, the metadata fields, the orchids, and so on are open for the world to consume. So people can find it, as I just showed you. Because if you don't do this work, nobody will know that your data exists. If you just put it on a departmental website, you didn't do anything by that. The only thing you did is just maybe exposed it to Google and maybe not. It depends how you set up your departmental website. If you put it in an established repository, you're really open to the world. We take this data and ship it everywhere, as I showed you. Now, having said that, the data itself, the data files themselves have a lock. So they are not open to the world. If somebody wants to have this access to this data set, they have to request access. And by requesting access, like if you click on terms, where I will, maybe not today, but because I'm looking at the time, where we explain how to use this data set. There's like a license assigned, but there's also instructions of how to gain access. So you can potentially do that. You open your data to the world by opening the metadata. You maybe open your README file, maybe open your data dictionary, but the data itself can be locked and you will control the access to it. Again, there are multiple advantages to it because first of all, you make your data findable and interoperable, and you assign a proper license to it. But people can also ask you for access to these data sets. We have a lot of this in indigenous data as well. If any of you work in the indigenous data field, here's a good example. This is in pharmacy. Approved Dataverse is a collection from our colleagues in pharmacy. And each of those data sets is controlled by the indigenous partners. So you'll see each of the data sets is locked. And if people want access to it, they have to follow the instructions. You can open it yourself, of course. Jeremy, as I speak, maybe you can share a link to, if you don't mind, to the Approved Dataverse and also to the pediatric sepsis. Thanks for supporting me, and I will do the same for you. Did it answer your question, Walter?
Yeah, thank you. I'm checking here Approved, and thank you.
Yeah, for sure. I'm going back. Actually, I haven't actually started, but I will keep it really quick. In my plan, I had a little practice for you when you actually deposit a data set. But again, every one of our workshops is step by step, is self-paced, is computationally reproducible. Just do it yourself. Practice, see how it works for you. We give you access to the demo server, where you can actually practice and see how it might work in real life. I give you a data set to practice, so you can try your own, and we explain each of the steps for you that you need to make sure your data is fair. I have a one-pager, as I was showing you last week. Each of our workshops has a one-pager where we explain how to do it, something you can take along to your colleagues to your peers and show them and share of how to do things. We have a variety of those. This is just a basic deposit for data. We also have a advanced deposit, we have an admin deposit, and so on. What we can do for your institute, if it's of interest, we can create something. I'm going back, sorry, I'm clicking links here. Hopefully it's not too confusing. We can create something like a subject collection, like the pharmacy people, or a lab in human kinetics, which you will serve as a data administrator, where you will make those decisions how to deal with data. We will train you. My team will train you. We have 4 people on our team, the research data team. We will train you how to work with data. We will train you what we want to see in terms of curation, but you will manage the data yourself. That's what happens with pediatrics people. That's what happens with some labs. That's what happens with the pharmacist, and so on. So we don't have to manage the data for you. We would like to train you, but you could manage the data yourself. There's one more thing I want to mention, and then we maybe jump for questions and some discussion. Going back to, again, all the workshops, we shared them with you before Nicole, I think we sent the URL last week. It's the same URL that we shared last week, so we can see.
Yeah, the people joining us today who weren't at the last session might not have them, but I will follow up and
Yeah,
send
the
it to
URL
everyone.
is here, so I will paste it in the
Okay.
chat so everybody has them. Although my Zoom window changed, so I actually cannot see the chat window disappeared on me.
I've just posted.
Thanks again. One more thing I wanted to mention, and it's going to scare you. I'm going back to this page. I assume you get funding from the tri-agencies in Canada. I assume most of you are familiar with the tri-agencies. You know what they do, the CIHR, in your case is in SHRC. You most probably try to apply for grants with the tri-agencies, but you might not have noticed the new policy for research data by the tri-agencies. I'm going to open it for a second and show you a couple of things, and then we'll open it for questions. The policy was released a year and a half ago-ish, and some of it applies to us as an institution. So we are, as an institution, the UBC is supposed to create a research data management strategy. And I've been leading this work. I think I showed it last week. Here it is, the policy. Sorry, not the policy. The strategy is here for UBC. We have a strategy released this year in the spring. And now we have a working group to implement the strategy. We have people from advanced research computing, from Faculty of Medicine, from ethics, and from indigenous initiative to work with us on that. But what I want to show you is actually something else. As researchers, we talked about data management plans last week. I quickly showed you the software we recommend you to use to create those. But this I did not touch it last week. So that I'll let you read this quickly, this sentence, because this comes online starting with next year. So the tri-agencies want you to start depositing data. They want you to start thinking about making your data public, including your code and metadata. Of course, it will be not applicable to all disciplines, because if you work with indigenous data or sensitive data, you will, in most cases, will not open it to the world. But in many other cases, you will be required to open it to the world. So I want to prepare you. And if you stay in academia for a while and you do plan to get tri-agencies funding, get ready to what I was showing you, because you will be required to deposit some of your data in the very near future. So this is gradually implemented, and they're planning to start requiring data deposits with 2025. Now I will stop sharing. I will go to chat and answer everything I can, and then we maybe open the floor for questions, and I've done my half an hour. Oh, there's no questions, just links. Thank you, Jeremy and Walter, for posting them. Does anyone have anything to ask or share or to complain? because it's more work for you for sure, but we actually do lots of work for you in terms of helping you with your data curation. So what we do in EBC, we don't take, like if you're familiar with Figshare or things like that, they will take your data and post it as is. We don't do that, because in most cases, we found the data deposits, in most cases, they are substandard. The variables are not defined, the README file is missing, author's information is missing, the data is not connected to articles. All those things, we actually fix it on our end. We do a very robust data curation process, and we ensure that the data that is published is of a decent quality and will be of use to your peers. And we do that for, I would say, a good 5 years now. And we have more than 20,000 data files under management in EBC. Okay, I'll shut up because I can speak for hours. So if there are no questions, we'll move to Jeremy.
I do. I hope it's, I hope it's related, because my intention is to do research that involves online assessment. And out of academia, we've been using Amazon Web Services. But once we start doing it through academia, and that's my wish, we will need to collect data in a protected environment. So I wonder if that that certainly should be included in the data management plan. How to collect it as well, or just how to deposit?
No, it's definitely how you collect it. In data management plan, we'll ask you this question. We'll ask you how you collect your data. Now, what I recommend, have you discussed this with our advanced research computing colleagues? And, yes, okay.
Yeah.
Because they have my colleague, Luke, he's the data privacy specialist for advanced research computing. So between the privacy team in ARC and the storage team in ARC, they can recommend you the right storage for your sensitive data, and the right level of protection. So again, we kind of it is a task that we cannot do alone in this institution. So the library does the data repositories part and data sharing part, while ARC does the data storage and data protection. So we work with them on a daily basis. If you have any questions, specific questions, Walter, we'll set up a conversation between all of us and help you. So it will be very specific in terms of your project, but it might not be relating to everybody else. So just reach out and we will be able to help.
Thank you, Eugene.
For sure. Great. Jeremy, all yours.
Thank you, Eugene. So I'm going to be shifting gears somewhat with my part of the presentation, and a change also from the presentation you had from Eugene last week, where the first parts were a discussion really about proper management and storage and distribution of data that you're collecting. Emphasis during my presentation is going to be on finding data sources that you might want to pull in from elsewhere into your research. So I'm just going to take a moment here and share my screen. And I'm focusing, as you can see in the slide, on finding mental health data. So this is really an overview of sources, and I am going to ask for some input from you because we're a relatively small group, and I don't want to bore you with introductions to sources that you might already be familiar with. So my plan is to introduce some data search strategies. very likely many of the things that I described will be familiar to some of you. My hope is that as I go through it, you may pick up some tips here and there of things that could be useful to you. Then I want to look at demonstrating some potential data sources, as well as providing a reference or list of resources that you can use in the future. So the slides themselves will serve as a guide if you want to check those resources. I've linked to many of them from within these slides. I just put a link to the slides in the chat as well. Those will remain available at that link. And so you can explore on your own after the session as well. But over to you right now. I'd like to know what data sets you use looking for mental health data, or even other health related data, and where you look for data. And so I'll just pause for a moment here. We're a small group, so if any of you want to just unmute, that's great. If you would prefer to just put a note in the chat, that's good too. Entirely optional, but it will help me steer things into areas that might be of greater interest for you. Thanks, Eugene. Google Data Search. All right, so online repositories for neuroimaging data. Thank you. I'll leave this as an open question. I'll go through things, and if I start talking about something that you have some familiarity with and you have questions about, please jump in, throw in your questions in the chat. There's space here to take it in a few different directions depending on your interests as well. Thanks for mentioning the existing surveys and studies. That's something we'll definitely spend some time looking at, and potential sources. And when you say existing surveys and studies, are there particular providers or places that you are familiar with?
Oh, hi, can you hear me?
I can, yeah, thanks for unmuting.
Yeah, so I just mean, like, in my experience as a master's student, I just, like, I was looking for data to write my thesis rather than collecting my own. So my supervisor had a longitudinal study. So that's what I mean by existing surveys or studies.
Excellent.
Also, I guess just getting in touch with researchers who already have some kind of publicly available data, sometimes maybe through PubData BC, that kind of stuff.
Perfect. So you're familiar actually with some of the resources that I'm going to mention, and Eugene's talk blends well with this, because we're talking about, or he was talking about, sharing your data in ways that make it easy for other researchers to find, which really facilitates that data discovery part when you're looking for things. We'll be talking about general sources here. So for data from other researchers, you just mentioned, I'm graying that one out though for my part of the presentation, because Eugene's already identified some repositories where you might be looking for that. So I'm going to be focusing more on statistics from various agencies and organizations, administrative data. Certainly administrative data is one of the things that you can get from PubData BC, and if you haven't heard of that before, we'll talk a bit about that later. And then also survey data. There are many paths to starting with a data search. One, Google Data Search, not a bad place to start. Certainly just throwing some keywords out there into various places works, but often a good way of focusing the search is looking for articles or publications that are on topic, where you can look at their citations and explore a bit deeper. So this particular journal article here, you can see from the subtitle, Descriptive Analysis of Population-Based Linked Administrative Data in British Columbia on Mental and Substance Use Disorders. It's really on point. We're of course not always going to get something that is as specific as this, but combing through a resource that you find, an article that you find online, and looking at the citations is a great way to go. This is just a snapshot of the methods and data section of that article that I listed on the previous slide. And in this section, they mention the National Ambulatory Care Reporting System. They mention the Medical Services Plan as a source for data. They mention Discharge Abstract Database. I'm not, again, expecting that you know all of these things already, although some of you may. The National Ambulatory Care Reporting System records data for visits to emergency departments. Medical services plan is for payment information, in this case, for visits to doctors. And then the discharge abstract database is discharges from hospitals. And some of these are managed actually across the country. So jurisdiction, understanding the jurisdiction of the various data sources can be helpful in understanding whether they're going to be relevant to your research. Naming them, of course, doesn't do a whole lot. So I want to talk just a little bit about accessing. How do you get at some of this administrative data? Those 3 items that we listed on the previous page are referred to as administrative data because it's the kind of data that's collected in the course of governmental or other organizations going about their business. And so this is data that supports or is used in planning, not collected as surveys, but sort of interactions with the medical system, as it were. And there's 2 sources that I link to in these slides. One is Population Data BC, and I'm just going to open that in a new tab as well. We'll look at that briefly. Could I get a show of hands, as it were, but if you could use the reaction pane to give me a check mark or a red X for whether you've encountered Population Data BC before. So I'd love to hear from everyone using the reaction pane in Zoom, a check mark or a red X to indicate if this is new or familiar. Great, nice to see that it's new for a couple of you. I hope not to bore everyone with known resources, but Population Data BC is an organization that facilitates access to administrative and other data, and behind the scenes they establish data linkages and so make it much easier for researchers to get at data that we otherwise would not have access to. I'm not going to go into the details of connecting with them, but their website does guide researchers through the process and also has links to view the data that's available. And so some of those things that I mentioned in the previous slide are available from this list of various data sources. It's a fairly long list. An excellent resource for data in BC. Now, it is in part strong because it is focused, it's regional, and a lot of the data collection is happening at the provincial level. It becomes more challenging sometimes if you're looking at national studies and need to get data across the countries. The Data Access Support Hub is a resource that's actually also linked from Population Data BC. And this performs a similar service as a hub for researchers for getting multi-regional data. So again, primarily administrative data, but working across provinces. So there are just a couple of places where you might go for getting at administrative data. The article that we looked at a bit ago also used something called the Discharge Abstract Database. And keep that in mind, we actually have that available to UBC researchers directly through the library's data repository. And so if you've worked with the Discharge Abstract Database or have a need to, if that fits your research need, that data is even more readily available than some of the things available through Pop Data BC. I'm going to another item here that was linked from that initial article. And this one is, was thinking about this article actually when Eugene was talking about findability, because it's available from the citations of that previous article, but it's posted on a departmental website within UBC and a little trickier to find, except not findable in the usual journal searches. But this provides a few other more detail about how that previous study used the administrative data. Another item mentioned there is the BC Data Catalog. And I wanted to share this page because it's often useful to get demographic data to match up with health data. You might be collecting health data that's provided for various geographic regions. Statistics Canada can provide, through the census data, population counts for various areas. But there are resources such as the BC sub-provincial population estimates that pre-groups that for you. And so you can see on the right-hand side here that these population estimates and projections are available in community health service area breakdowns, in health authority breakdowns, in local health areas. So depending on the kind of research you're doing, you have a few options, and it can save some time rather than working with the Statistics Canada data directly. I want to pause there for a moment, just check in case there are any questions here. Again, feel free to jump in if you have questions about what you see, or if you've worked with some of these and have tips that you'd like to suggest with the rest of the group. That was my brief intro to administrative data. I want to talk a bit about finding Canadian survey and census data. The examples I'll be looking at are using very generic keywords, just mental health, and we'll be looking primarily at surveys, but the pathways and the concepts are very similar if you're working with a census or other data released by Statistics Canada. So we will focus on Statistics Canada for this part, and I'm going to look at 3 levels of data that they release. Statistics Canada has something they sometimes refer to as their continuum of access, with various public data that's low risk, no privacy disclosure issues, is packaged in many ways. As you get further down the chain, you get public use microdata files. Those are also public. And then you can go to the research data centers for access to data that requires more security. I'm again curious how many of you are familiar with the Research Data Center program, whether you've used it or not, just whether you've heard of those research data centers before. And again, green check mark or a red X. Looks like a bit of both, but more of you are new to this, so that's great. So for Statistics Canada, I'll step through each of those previous bullet points. We'll start with the published tables. And I have a few slides here that are really just for your reference later, but we're going to go to the Statistics Canada homepage here and do this in real time. So from any StatsCan homepage, you will be able to find this banner across the top. And not surprisingly, the Data tab takes us in a helpful direction for searching for data. This filter set on the side allows you to filter by keyword, subject, and perhaps even more usefully in some cases by survey or statistical program. So if you happen to know of a survey that Statistics Canada administers, such as the Canadian Community Health Survey, CCHS, you can expand that list, and it is probably hundreds of items long, and can narrow in and see what are all the data tables that Statistics Canada has packaged and released based on the data for that particular survey. So that can be one pathway in. Another is just going by keywords. So I'm going to try a mental health search here. And by looking at the results, I see my first one is average weekly earnings. I'm probably getting things that have those keywords in them but aren't super specific. If I narrow down a little bit more by subject, I can drill into the health tables there. And in practice, you would probably want to drill in even a little bit further. We're still looking at 171 tables. But for illustration only, I'm just going to click on the health characteristics annual estimates table that comes up at the top of this list. This display might be familiar to many of you. It's the standard now for Statistics Canada tables. There are often some options at the top for customizing the table. I encourage you not to take at face value what you see on this page in terms of whether it's the full picture or not, because often there are options that aren't listed in these dropdowns that are also available by clicking on the Add Remove Data button. And that brings up another display that sometimes allows you to get at smaller levels of geography, add more detail, add a few different age groups, for example. So the Add Remove button would be my recommendation if you come to a table and it's almost there, but it's not quite the right thing. Click on that and just see if there's anything that you can change that gives you more options. I'll do that to demonstrate. And you can see here that allows you to go through and you can click on the plus arrows for each one of these tabs and find out if there's other options for how to display things. In this table, there's actually not a whole lot more we can do with it. So we'll just go down and look at the table itself. So we're looking at a number of rows here that have to do with mental health, quite a few other things as well. And I'm just going to call your attention to these two. Perceived mental health. So this is a survey, or it's coming from a survey. It is self-reported perception of mental health. So we have to consider that data with perhaps some caution. But they've grouped together into two categories, either fair or poor, or very good or excellent, and given us population count totals for Canada in the various years for within the survey population. What happens if I want to subdivide that and get at a little bit more detail? One of the reasons I like starting with these tables is if you find something that's close to what you want, you can go down to the very bottom of the table and click on sources. And this will tell you what program or what Statistics Canada survey the data is coming from, and can serve as a launching pad for the next stage in your exploration. So if I click Canadian Community Health Survey here, it's going to take me to a Statistics Canada site that just tells me a little bit more about it. But what I really want here is to move into the next level of detail that's available from StatCan. So we started at published tables. Number 2 is looking at what are called public use microdata files, abbreviated as PUMFs. You'll get tired of this, but again, the green X and red check mark. Has anyone worked with PUMFs before? Public use microdata. All right, this is good. We're drilling into new territory. So they provide case level statistics. So instead of getting a table where everything's grouped, you get to look at individual responses from the survey. Excellent tool for researchers, and really a lot of data there so that you can generate your own tables and look at the variables of interest against other demographic variables that might be in the survey. There are some limitations because StatsCan has to protect privacy. Some variables are suppressed or grouped. So things like ages might be provided in age groups. Income often appears as income groups if it shows up at all. And a major place of aggregation is geographic detail. So the survey itself is collecting all the way down to, in some cases, addresses. What you're seeing in a public use microdata file is often, at the lowest level of geographic detail, something like the metropolitan area or province in some cases. Still often quite useful. So for PUMFs, we collect those in Abacus, which is UBC Library's data repository. And that link takes us to an Abacus homepage here that looks very much like the search interface Eugene was showing. It's running with the same software in the background, just in a different instance. And I know that we're looking for a Canadian Community Health Survey because we want to see if there's a PUMF for it. So I'm just going to run that search there. And we can see indeed that we have a few results. I'll sort those starting with the newest. And I know from working here a bit that the Canadian Community Health Survey from 2017-18 is actually the most recent that we have available as a public use microdata file. So I'm going to click that and just give you a very brief orientation to this record here. There's, of course, always a description that tells you a little bit about what the survey is collecting. And then we've tagged our files as either documentation, command files, or data files so that you can filter by tag and find the relevant information. Documentation will include almost always some kind of user guide as well as a data dictionary. And so just to save time in this presentation, I've actually opened that data dictionary in another tab here. And we can look at the listing of variables. And what I've highlighted here is the perceived mental health variable, GEN_015. You can see on this list that there are also variables about education level, perceived sense of belonging to community, many other things that could be potentially interesting to map against that perceived mental health. And if I click on the mental health variable, you can see how it's displayed in this codebook. So you can see that my options were actually excellent, very good, and there was a good option that wasn't represented in our data over there, and fair and poor, and I can get the breakdown that disaggregates what was showing up in the StatsCan tables. So the goal here is certainly not to have you feel like you're confident in navigating these resources, but that you understand an initial block often can be resolved by finding the data access point that allows you to get at the more detailed data. So that was a brief intro to pumps. The next stage here is the research data center. So if you happen to be working with something where you need the geographic detail, or you need one of those variables that's been aggregated, or you need data that hasn't been released as a public use microdata file, because it's not every survey program gets that. You can apply for access as a UBC researcher to something called the Research Data Center. And if your project is approved, you'll be able to go into the Research Data Center, run your analysis against the main files that Statistics Canada maintains in that space. And this will give you access to data sets that you would not otherwise have access to. An example, there's a longitudinal international study of adults. Again, something that has mental health components in it, and that has been tracking adults for a fair bit longer. I need to look at it now to see every 2 years since, I think, 2012. And so you actually get a longitudinal study with the same people responding, and you get to see change over time. So these studies always have greater privacy constraints, and the Research Data Center is the way to get access to something like that. About 5 minutes left. Yeah, Walter, please jump in with your question.
On time. Well, so can you perform an analysis without access to the data? Just input your analysis code, Python, whatever, MATLAB, and get it on the server or something without really needing to download, in case you would need to download a lot of data, or you would need a lot of processing power to analyze it.
Yeah, so with that question, are you referring to the public use microdata files or to some other?
Yeah, I guess you mentioned something there, or I got it, but maybe I got it wrong.
No, I think you may be referring to the Research Data Center, which has the more sensitive files. Is that right?
These slides.
I'll continue. Yeah, this slide. So
Yeah.
this would be a case where Statistics Canada won't share that data with you, and so, or
Yeah.
not outside of their environment. And so you apply for access, and then you go to a physical space at UBC Library where Statistics Canada employees are kind of they're not supervising or addressing your code, but they allow you to, in that space, run your analysis. You get to leave with the results of your analysis, but you don't get to leave with the data. So yeah, that's the way that works. Good question.
No, I just want to make sure I understood. Thank you.
Yeah. Emphasis was on Canadian data sources. So I did include a couple of slides here with US resources for those who might want to go more broadly. And some of the things, or at least one that I mentioned on here, does have some international coverage as well. I realize it's a pretty skewed perspective. It's just an introduction to some pathways. But National Institute of Mental Health has some resources. Similar principles apply when searching those to the data tables. This is an example of the page that I linked to here, where they have grouped things by topic. If I drill into something like autism spectrum disorder here, it'll give you a bit of stats. But really, one of the reasons I like this is get to go deeper to the data sources section, where you can then go in a little bit further. And each of those sections or subsections within this page will give you direct links to data resources. So that's true of several of the resources that I mentioned on this page. I also wanted to mention access to surveys in the US. And the first link I mentioned here is something called the Inter-University Consortium for Political and Social Research. That is not US specific, but is strongest in its collection with US data, which is why I've grouped it in this area. The link there will take you to UBC Libraries page for ICPSR. And I recommend connecting from this page, because that will allow you to create an account. Because it is a paid resource, some data sets are free, but some are not. And some you'll only be able to access as a UBC researcher. But once you're in, you are on a page something like this here. And I've queued up a search for longitudinal study of health. And I'm just going to illustrate very similar to what we have in Abacus. I'm going to click on this study from 1994 to 2018, I have found that in Canada, it's harder to find longitudinal studies, at least those done that are widely available, that are where the data is available online. ICPSR, perhaps because the surveys are larger and the risk of privacy is not as big. In the US, there are a few large studies that allow that, and maybe a good place to explore and play around with data. The reason I want to show this interface is that in addition to the at-a-glance description, there is a tab for each data set that allows you to look at the variables straight away and to actually search them. And so I just click to the variables tab here. And if I search for something like disorder, it's going to search through the questions as well as the names of the variables in this study and show me different questions that are asked. So I can somewhat quickly see whether the survey might have something of relevance to my particular study. The very last year is national longitudinal surveys from the US. And that's just a link to this page here. This NLS youth study from 97 onward takes, I believe it starts with respondents aged 12 to 17 in the 90s, and it's been carried through all the way through to, I think the last wave was in 2022. Topical guides here suggest that it has data also about mental health. So principles are the same for all of these. I just wanted to give you some slides with links that you'll be able to access later to explore some of this data. So that's the end of my presentation, and I'm very open to your questions or comments. I would like to add that I'm available for consultations if you are looking for data of a particular kind. It's really artificial when we do these presentations because we can queue things up just so. It's a lot trickier when you're looking for something of your own. So you're welcome to reach out to me with your questions.
Again, thank you to our speakers for your time. That was fantastic. And thank all of you for coming and for your time as well. See you at the next webinar.